I originally went into medical school, I was open to any specialty. I didn't have a lot of family in medicine, so I didn't know any of the particulars about different specialties. I originally thought I wanted to be a pediatrician because I love children so much. OBGYN actually, I think, spoke to me a little bit more. It's women's health. I felt like I could relate to my patients a little bit better and go from, throughout their lifespan, and also being able to treat issues that they're maybe not comfortable talking to a lot of people about, and knowing that they have me as a sounding board to discuss, and that I can actually see a treatment working and see them go from not feeling great to feeling better afterwards is really satisfying. So I actually went to residency at Inspira. So I started out my life in Florida. I went to undergraduate in Florida and medical school in Florida, and then residency, and I was put here in New Jersey, and I'm happy. I met my husband here. I'm now raising my family here, and Inspira has always been my alma mater and my home. I did residency, and I'm happy to stay. I just had a beautiful baby girl. She is pretty much my entire hobby and interest right now, but when I do have a little bit of free time, I like to do a lot of crafting with my hands. So I crochet, I have made baby blankets for friends of mine, and I have 2 border collies who are also the other half of my world. And my husband and I do like to take them to parks and go hiking and things like that with them. One of my favorite things to talk about with patients is travel and places that they've been, and places that I've been. So my husband is Portuguese, and we try to go to Portugal pretty regularly. I think it's also important that patients know that I speak Spanish. I do obstetrics, which involves pregnant patients from the very beginning of pregnancy all the way until delivery. I do C-sections, vaginal deliveries. We also see high-risk patients in our practice. So in collaboration with the maternal fetal medicine department here at Inspira, so any patients who have gestational diabetes or preeclampsia, other sorts of high-risk issues, we'll see them. We see patients for their annual exams. We see them for things like pelvic pain, abnormal bleeding, uterine fibroids, polyps, things like that. And then we also do hysterectomies, surgical procedures. I am trained to do minimally invasive laparoscopic hysterectomies and laparoscopic procedures. And I'm also starting the process of being a robotically trained gynecologic surgeon as well. I think the most exciting things about OBGYN is all of the minimally invasive treatment options that we now have for gynecologic disorders. Decades ago, the only thing that we had to offer people was just to do a hysterectomy and that's it, you're done. But now, today's patient is not necessarily interested in such an invasive procedure if it's not necessary. So we do have a lot of medical treatment options, we have implant options, we have minimally invasive surgical procedures that are available, as well as some patients do need to end up having a hysterectomy. So, we have a whole host of treatment options available now that didn't exist maybe 20 years ago. I like to treat patients as if they are my family. So anytime I see patients in the office, I think to myself, how would I want my mother to be treated, or a family member of mine, and I try my best to do that.